If you're thinking about using hydrochloric acid supplementation for SIBO, well, you're in the right place. Conflicting views about the use of hydrochloric acid seem to persist, suggesting that it may be more of a problem than a solution. Does this really make sense? Well, let's look beyond the initial overgrowth for SIBO and give you reassurance about whether to or not to use hydrochloric acid. I'm always intrigued by conversations about how to manage SIBO with practitioners of all backgrounds. The conversations always default to which antimicrobials are the most effective. Well, here's a news flash for you. They're all effective. But frankly, what difference does it matter which antimicrobial you use if the results you see aren't going to be able to be maintained? Well, that's why we need to be focusing on digestive secretions. And at the top of the list, that's hydrochloric acid. But before I tell you where hydrochloric acid fits into a protocol and how to use it, allow me to briefly introduce myself. I'm Dr. Arland Hill, and for the last 20 years, I've been helping first-time and recurrent SIBO sufferers restore their gut function by targeting all three phases of the condition to resolve symptoms in a timely manner. Are you okay if I start out by giving you some immediate clarity on this topic? Let's begin with a quick overview of what hydrochloric acid does. Hydrochloric acid has many benefits when it relates to food digestion and nutrient assimilation. It's going to help us be able to break down proteins effectively. It's going to give us access to minerals, things like calcium, magnesium, for example. It's going to help give access to other nutrients like B12, iron being another mineral here. It's going to reduce the overgrowth of microbes that are coming in through the diet that are naturally present there that need to get eliminated, or the microbes that we inherently swallow from our upper air passages. It's going to give us the ability to adequately secrete enzymes from the pancreas. So when you look at these, clearly it is necessary for hydrochloric acid to be present. But what's also ironic is that everything that I just listed right there seems to be many times the opposite of what's taking place when we're discussing SIBO. Those are many of the either outcomes associated with SIBO or the things that allow SIBO to persist. So the question becomes, well, why wouldn't we consider the use of hydrochloric acid if it seems to be able to do the opposite of what we typically find with SIBO? Well, here's the answer to that, and it comes down to that there are opposing positions for the use of hydrochloric acid. And those opposing positions generally state that the hydrochloric acid is going to add to the problem. It's not going to be part of the solution. It's going to be part of the exacerbation of allowing these organisms that make up SIBO to continue to persist. And it's the reason that that's suggested is that, as the name implies, hydro is part of hydrochloric acid. That hydro is related to hydrogen. And so the suggestion is that you're increasing the hydrogen gases, and this is going to lead to symptoms. What symptoms are we referring to? Well, that's going to be things like gas, bloating, distension, pain in the abdominal area, changes to your stool. And this change to the stool that's obviously suggested around hydrogen is going to be that the stools become loose. And that's in opposition to methane, which that's just the other side of that conversation, which tends to cause the stools to not be as frequent, tends to push someone more towards constipation. But as it relates to hydrogen, hydrogen is also argued to be able to increase the production of methane and then also on towards hydrogen sulfide. So the conclusion is that that's all the problem scenario that we see with SIBO. So the suggestion is, and the conclusion here is that you want to avoid hydrochloric acid supplementation at all cost. However, here's the problem with that position. And there's actually multiple problems with that position here that we need to acknowledge. And I feel like when you enter into a conversation of saying whether something should be considered for intervention as part of a treatment, you have to look at just common sense physiology of how things work. And so that's what you're going to see is really driving a lot of these counterpoints that I'm going to present to you today. So one, let's look at the utilization of drugs for a minute, and specifically drugs that lower acid production. You guys know these names. These are things like Protonix, Pepcid, Zantac. I mean, these are things that you can grab over the counter. They're written for prescriptions at times, but it is very well established that these increase small intestinal bacterial overgrowth. And so right away, we can see a correlation here. We have a decrease in acid production from these drugs, but yet they increase small intestinal bacterial overgrowth. And they're so well established in being able to do this and doing this that they're considered to be a primary cause. So these acid reducing medications, whether they're PPIs, proton pump inhibitors, or H2 agonists, hydrogen agonists, they're going to inhibit the production of acid, which leads on to the overgrowth of small intestine. And this is such a firm connection, firm correlation here, that we actually know that PPI use is a subcategory of SIBO. So SIBO-induced PPI or PPI-induced SIBO is what we find here. Now, the outcome from this is that as you lower acid, it increases SIBO. And so this is contradictory from the fact that you don't want to use hydrochloric acid, right? So this doesn't make sense. So the conclusion from what we see based on drug observations would suggest that you do want hydrochloric acid. But remember, this is not the only counterpoint here. So let's move into the second counterpoint, which is going to be that hydrochloric acid is a source of hydrogen. So the argument here would be that allows for availability of hydrogen that these microbes can use and can proliferate with. Here's the problem with that, is that hydrochloric acid is not the only source of hydrogen. In fact, some of the sources of hydrogen that you're also consuming are actually far more prolific. So for example, let's talk about water. You guys have all seen the chemical structure for water. It's even abbreviated a lot of times, H2O. We refer to it that way many times. So that tells us there's two hydrogen molecules and an oxygen. And when you consume water and it's aiding in the digestive process, hydrogen comes off of that oxygen pretty easy. So you've got a free hydrogen there. But water is not the only source of hydrogen either. You also have carbohydrates as a source of hydrogen. In fact, every major macronutrient, carbohydrates, proteins, fats, they all have hydrogen. And so let's focus on carbohydrates for a minute and understand that when individuals that suffer with SIBO consume carbohydrates, not everyone is developing symptoms related to that carbohydrate consumption. This is part of the argument against the FODMAPs diet. And if you haven't seen some of my other content, you may not have as much information in your background in terms of where the SIBO or where the FODMAPs diet actually doesn't fit into SIBO. So you can check out the card here to dive into that content. But for us today, we want to acknowledge that this FODMAP diet, which could be considered an anti-prebiotic diet, so it's not aiding in the proliferation of these microbes. So the point is that when you're cutting out all these sources of hydrogen through the diet, you're not actually aiding the beneficial organisms to proliferate. You're not inhibiting the growth of these dysbiotic organisms, these problem organisms that can be associated with SIBO. So it's not an ideal dietary pattern. So taking those carbohydrates out, it's anti-prebiotic. It's doing the opposite of what you're trying to accomplish. So it's just another illustration that taking hydrogen away, well, one, taking hydrogen away through things like carbohydrates and your macronutrients and especially water, that's just not even logical. But also taking these out in portions of your diet doesn't seem to create any real symptom improvement. Here's the third counterpoint, and it involves testing. And testing is often, specifically breath testing. Breath testing is often used as the justification because of the observations on the breath test as to what the outcome should be or how to approach this. Here's why you can't even really go down that road, is that especially when it comes to hydrogen as the gas that you're trying to assess with a breath test, these breath tests lack sensitivity and lack specificity. So what that means is that they're not giving you a true negative or a true positive. These results have a lot of built-in errors with them. And so they're not the best tool for drawing a conclusion about what's going on with the physiology. They're just inaccurate in many scenarios. So you can't rely on an inaccurate tool to draw a conclusion about a gas that's being produced in the gastrointestinal tract. It just doesn't logically make sense. Here's the fourth counterpoint, is that your inherent production of hydrochloric acid prevents overgrowths. So I mentioned earlier about swallowing these bacteria from your upper airways, about having these come in through your food supply. When you're consuming those and when you're ingesting those and they make it down to the stomach, you release that hydrochloric acid, and that hydrochloric acid is drastically reducing that microbial overload that's coming in. So if your natural production of hydrochloric acid in your stomach is reducing the overgrowth, how can taking a hydrochloric acid supplement, which mimics that, contribute to it and make it worse? You see, we're at two opposing conversations here, and one follows physiology, which says that hydrochloric acid could be of benefit, and the other one just doesn't. But before I tell you the number five counterpoint here, which is by far the most powerful reason of all that suggests why you should be using hydrochloric acid and why avoiding it doesn't make sense, if you could hit that like and subscribe button so you can help me get this information out and share it with others that are looking to try to resolve their SIBO symptoms as well and experience the same benefit that you're going to get from this content. Now, let's move on into that fifth counterpoint that is most powerful here. And that is that this is probably what is most obvious to illustrate that hydrochloric acid and hydrogen are not a problem. This one statistic, so listen to this. 70% of the intestinal bacteria are hydrogen producing. 70% of your normal intestinal bacteria are hydrogen producing. And what the observation has been with this is that number goes down in chronic disease. So that suggests that there is an association that as these hydrogen producing bacteria decline and their production of hydrogen declines, that we see an increase in chronic disease. So therefore, we would want more of these hydrogen producing bacteria, which means we want more hydrogen available. And that hydrogen, part of these hydrogen producing bacteria, part of the reason that they benefit is that this helps produce acetic acid. Ironically, many of you will know that as vinegar. And then they also produce butyric acid. And these hydrogen, the excess hydrogen or the available hydrogen, that's a better way of saying that, the available hydrogen that they produce, how does it work? Well, what it does is it protects from oxidative stress. It protects from your body literally degenerating over time. Now, you think about it this way. It has an antioxidant role is what it comes down to. And so we know that this oxidative stress can be countered by antioxidants, where hydrogen fits in this conversation. And oxidative stress is an ongoing part of all chronic disease. It doesn't matter if you're talking about cardiovascular disease, metabolic syndrome, cancer, neurodegenerative conditions, joint conditions, arthritis. It doesn't matter what degenerative condition you're talking about. Oxidative stress is a player in that. So we can see that the more hydrogen you have available, the more that advances your longevity. So again, does it make sense to have access to hydrogen, or does it make sense to just avoid sources of hydrogen like hydrochloric acid, which can have multiple benefits in this SIBO conversation? the conclusion here is pretty clearly that hydrogen availability is not a problem and that more HCl would be ideal when it comes to trying to help manage your small intestinal bacterial overgrowth. Now that you can clearly see that there's a place for hydrochloric acid, let me give you direction on options for supporting hydrochloric acid, because you don't just have one here, and there's some of these that are often overlooked but are extremely necessary to consider. The most obvious and the one that is probably used at the top of the list here, that's used the most, is going to be betaine HCl. Just so that stands for betaine hydrochloric acid, or betaine hydrochloride. And a lot of times you'll see that this is combined with pepsin. Pepsin is an enzyme that's produced in the stomach, and you need the hydrochloric acid to activate that, so it's part of the digestive process here too. But because betaine HCl is often most used, let me give you some direction on how to use that. When you take it, you want to use it just before eating or during the meal. It's not advised to use it after the meal. You want it to be mixed into the content of your meal and to support that digestive process. But it's especially important when you're looking at trying to manage SIBO, because you need to get this in either when you start your antimicrobials, or this is a lot of times what I do with patients is I have them start this after their 30-day antimicrobial phase of treatment. So that way we can get the antimicrobial component out of the way, and we can really emphasize the driver of SIBO, which are these digestive secretions, and put some attention towards hydrochloric acid. But if you just absolutely need it, you could start it while you're using antimicrobials. But that's betaine HCl, and remember, that's not the only option you have. Another option you have here are going to be bitters. Bitters are going to stimulate hydrochloric acid production. These are going to be herbs or botanicals that will go by names like ones that you're very familiar with, things like ginger and artichoke, but you also get things like dandelion and burdock in here as well, which you can drink those through things like teas. You can take supplements for that, but there's other ones out there as well. Those are just by far the most common. Now, the third option here is supporting your body's own inherent production of hydrochloric acid, and doing this through making sure that you have availability of key nutrients. This is the one that's rarely discussed, but I think it may inherently be the most important, because interestingly, many of these deficiencies, these key nutrients that I'm getting ready to share with you, these are also deficiencies that are very common when you start talking about SIBO. So for example, zinc, chloride, B1, B6. So chloride is the only one of those that's not known to be an inherent deficiency associated with SIBO. But having adequate amounts of a good quality salt in your diet can give you access pretty easily to chloride. But the zinc, the B1, the B6, those are common. I'll give you a quick way to assess this for yourself. If you look at your fingernails and you have white spots on your nails anywhere, that's an indication of a zinc deficiency. So fortunately, no white spots. So good appearance on the nails. But that's just one thing that you can easily keep track of to see how your zinc status is doing. That's called leukonychia. And then the last one is just change your eating habits. So what does that mean? Well, slow down and eat more methodically. Chew your food. Push your body into more of a relaxed state when you're eating. And that also, as simple as that sounds, it's extremely effective, and that'll help with the production of hydrochloric acid as well. Now, you shouldn't need to take hydrochloric acid indefinitely. This is generally going to be used for a period of time. Just for example, you use it, you are starting to absorb your proteins, your nutrients more effectively. Those are going to inherently help you start to make more hydrochloric acid on your own, and this should continue to be a beneficial cycle for you that continues to move you forward. The general recommendation here of how long to use this, about 9 months. And the reason I suggest 9 months here is that around half of the individuals that have SIBO and undergo treatment relapse at 9 months. And a lot of times the reason they relapse by that point is because they're not focusing on digestive secretions like hydrochloric acid. Now, there are a couple of exceptions to this, and those exceptions could be related to age. Individuals, as we age, we just don't have as good of a hydrochloric acid production. We also know that when we have gastric procedures, that's also any type of procedure that affects hydrochloric acid production could be could be a reason that you might need ongoing support there. So you really should consider your own personal scenario here and where that hydrochloric acid fits in. But earlier I mentioned that the stomach acid also leads to the production of enzymes. And before you ask, do enzymes have a role when it comes to small intestinal bacterial overgrowth? Well, here's a video that you can take a look at that'll answer that specific question for you.